how do you view the cost of medication? Actually, all of us actually sell medicine, which is a bit unique to our country. Most other first world health system, they would just write a script and then send it to the pharmacy to fill it. So that is what other people do. Obviously, our system has its merits because actually it's a lot easier for the patients. It's one stop. And in general, I understand from the pharmaceutical companies, actually they actually sell it lower to us so that we can actually pass the savings to the patient. So these are values that sometimes patients don't see. But on top of that, there is also this whole debate of whether original versus generic, especially talking about cost. We're talking about this generic versus another generic, the country of origin and all that. So how do you interpret this and how do you help the patient understand this?
I go first?
One more question. How do you stop? Which one do you choose to stop?
Okay,
medicine?
so I feel that this discussion about medication, right, is like discussing tires for F1 cars.
Okay.
So a lot of people are looking for the cheapest tire for the F1 car, but the most important is actually the driver. You want the best driver, right? And so when it comes down to medication costs, actually the most important is actually the doctor or the specialist who's advising you on how to take these medications, what are the side effects to look out for, how do we monitor, make sure we are hitting the targets. And so if we are, and so that part is actually a more important part of the conversation, right? If you are not monitoring, then any medicine you take will be fine because you don't know whether it's helping you, whether the quality is up there, or whether that's the right medication for you, as opposed to your friend or someone else who told you that, if you have high blood pressure, you should take this, right? It should be individualized. So when it comes down to actually discussing between generic and branded medication, the truth is that branded medication has gone up in price quite a lot. I think most of us receive letters from the drug companies
every year
that prices have gone up 5 to 10%. So I think, and that's on an annual basis. So patients should expect that the prices go up over time. Generics is a way to help to control those costs because for generics it's a more competitive market. But in a competitive market, of course, there are also challenges because the quality levels may vary from company to company and from batch to batch. So that's where doing the blood tests, seeing your doctor regularly is a way to do a bit of QC, right? To make sure that you are hitting the treatment targets. So when we talk about Healthcare SG, when we talk about the central purchasing of drugs, I was very amused to find that in the current system, atorvastatin 10 milligram is from one company, 20 milligram is from another company, and 40 milligram is from a third company.
Okay.
So just because you do well on the 10 milligram, I'm not sure whether when you increase in dose to 20 milligram, the results are predictable, right?
The purity of the ingredients is consistent.
So I've got patients who, after I increase the dosage, then they come back and say, I didn't see an improvement in my LDL, and then I switch them to unfortunately my own generic rather than from the government portal.
I've seen that also.
So
I blame it on the patient not exercising.
So there are many possibilities when it comes down to generics, and so that's why you need a good driver.
How about a specialist?
So in my clinic I keep generics and branded, but different medication. For example, I will have generic rabeprazole, but I will have branded stronger, more potent, newer medications. It's just that I found that things like generic omeprazole, which I'm sure you guys use a lot, when it's made from overseas, foreign countries, it's, like I say, the purity of the ingredients is not so good. Sometimes people take it, there's no effect. And so omeprazole has been around for at least 25 years. 25 years. So although it's cheap as chips, but again, you gotta say a cheap thing may not be so good.
Actually, it's not that cheap. Actually,
Is it?
It's not expensive, but it's not that cheap.
How much is it per capsule?
I can't remember, but I think at least 40-50 cents per capsule.
Yeah.
And this is not selling price, this is cost price.
And then I guess with the branded one,
Yes.
you know it's more potent. Potent means that
The efficacy.
yeah, efficacy,
yes.
you know, if omeprazole is +1, this potent one may be +8.
Yeah.
So there's a different levels.
Yes.
So you want your problem to be fixed faster, then I always give the more potent one.
Yeah.
Cheaper ones, I know it's good, but I would leave it for patients who have cost concerns.
You see, the tricky part about dispensing at our clinic is this. Patients a lot of times equate their speed of recovery to your standard of care.
Your skill.
Your skill and your standard of
whether you're
care,
good
right?
or not, yeah.
So if you were to use a good original, then sometimes it might not be as good, but your medicine is really good. They will deem you as good too. But on the other hand, you try to save money, you may be very good, diagnose everything correctly, but because you are trying to save money, just be good-hearted and save money for the patient, and the effect may take longer to come in, then they think you're a lousy doctor.
But that's why the skill comes in. That's why the Formula driver comes in.
Okay, the Formula
the
Formula One driver, right? Yeah.
The clinical acumen and the
Yes.
diagnosis. If you know this is a correct diagnosis,
Yes.
healing you faster or just extra 2 or 3 days probably doesn't really matter, right? As long as you say, I'm feeling good. So when your patient supposed to come for appointment, they call up and say, I'd like to cancel my appointment because I'm feeling all better. So you know you've done a good job.
That's right. Yeah.
Yeah.